What's our members? Hello, Imam. I'm good, and you? Sasa nafanya? It's working. Ndio hii za Kenya. Ndio hiyo. Ndio hii sha. Anaonyesha wazee. Ndio hii. Wao wengine kama sha ifanye.
That is Health Cabinet Secretary Aden Duale having fun at Kenyatta National Hospital with a patient, in quotes, and some members of staff of Kenyatta National Hospital joking around about SHA working. In truth, I have spoken to a few doctors around the country, and they inform me that for the past 5 days now, there has been a very big challenge with SHA, SHA, the Social Health Authority thing, and that getting approvals has become very dodgy. Watu hawapati msaada na SHA, so a lot of the patients, most of the patients around the country, not in Nairobi or Mombasa alone, like there's a total system failure, and most of the patients are being forced to pay cash for services, huduma za kiafya. The reason why today I want to focus on the Ministry of Health is because ever since the New York Times itupatie information, let me call it information, ya kwamba the US government na the president of Kenya entered into a deal whereby they are constructing an Ebola containment facility hapa in Nanyuki in Laikipia County. We have seen the Ministry of Health communications change drastically. Every single day, there is communication from the Ministry of Health that we are yet to receive, or we are yet to encounter, or we are yet to get our first ever Ebola case in the country. And the day before yesterday, or on Monday, I don't remember, I actually quoted one of their tweets and I asked them, is this a countdown? Something like that, to that effect. You can see the tweet on your screen. It's very disingenuous and very duplicitous for the Ministry of Health and our President Ruto to kind of play around with our health system. They have entered, President Ruto has entered into a private deal between himself and the US government. He has been given money, and now that money has to be spent, or it has to be seen to be spent. So sisi sasa tumekuwa ni guinea pigs, tunafanyiwa mchezo ya kwamba they kind of do propaganda. Wameingia sasa kwenye phase ya kufanya propaganda na mambo ya Ebola. And just listen to Aden Duale once again talk about Ebola on the 10th of June.
About Ebola, I want to assure the country that as of today, we have no incident. Two, Kenyans who feel medically not okay sometimes ask us to do tests. And we have done over 69 so far, and they're all negative. And I saw one of your newspapers saying that we are not quarantining them. If a patient is here and he has no symptoms and we find it's negative, we have no business to quarantine that Kenyan. Two, we have 23 facilities which are quarantine, treatment centers, isolation centers. One of them is where you are. Before you leave, go to Kenyatta National Hospital, National Police Service Hospital. About 12 of our very high-risk counties, already they have been mapped out. We are building quarantine isolation centers.
So I'm assuming most of you, my viewers, are Kenyans of sound mind, or just viewers of sound mind. It doesn't matter whether you are Kenyan or whatever nationality you are watching from. You see, this thing, it does not make any sense because we have never had a single Ebola case. Kenya has been very safely covered by our neighbors, including Uganda. Especially Uganda has taken a lot of heat from us with regards to this Ebola thing. And now for the first time in the history of our republic, we are importing Ebola patients into the country, treating them here, and these Ebola patients are not even, they are not even Kenyan, they are Americans. And Kenyans who will fall sick with this Ebola thing will not be allowed into that facility in Laikipia. Believe it or not, that is the arrangement between the US government and the Kenyan government. So why is it that they are working so hard at the Ministry of Health na President Ruto to kind of prepare us psychologically for Ebola in Kenya? Why is it that they are using so much energy every day to inform us that there is no Ebola case yet? And you know, right now, kitu ambayo imeanza kujitokeza ni kwamba there is a game being played with this Ebola thing, and that game is basically economic management of the country. And if you look at the places that are designated as high-risk areas, like one of them being Laikipia, another one being, for example, Taita Taveta County, and some counties in Western Kenya. Watu wanasema, wachanganuzi wa kisiasa wanasema ya kwamba the issue iko pale ni kwamba those places have a high concentration of minerals and mineral wealth. So the idea ya kuingiza Ebola into Kenya is to shut down those places and start illegal acquisition of these vast pieces of land that contain these rare earth minerals that are highly sought after by the US government. Yeah, that is being said around, and it is very scary, the extent to which our president and his greed will go to basically loot from the Republic of Kenya and its people. Lengths he will go to be complicit with foreign militias, foreign governments, to steal from the people of the Republic of Kenya. And the only thing we can do is wait and see what game they are playing. And I believe uzuri wa serikali ya President Ruto ni kwamba the time kila kitu wakina, everything comes out to light. Everything with time tunajua ukweli unajitokeza. And yeah, so let's be patient. Let's be extra patient. I can't even tell you to stay safe because, guys, we have never been at risk with Ebola. We will never be at risk with Ebola unless someone directly imports it into this country. It's something called biological warfare. I hope one of these days I'm going to talk about biological warfare. And this Ebola thing looks like one of the examples of biological warfare, whereby the one person is trying to bring war to his people, and because they have tried, you know, physical violent war imeshindikana, so sasa wanaingia kwenye ugawa biological warfare. This is your Jomba Mobili Mogodi. Thank you very much for always watching this channel. Continue supporting the channel. The number is 0799 428 109 on M-Pesa. Asanteni sana.